Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations. Today, we're in February 3rd, 2023. We've been doing things like this for 3 years now, a very long time to be working on a single pandemic. With us today, Vanessa Becker is joining. Vanessa is a familiar face who works on our modernization plan, and we'll talk with her later. The good news is after 3 years, the world of COVID has really slowed down. So for the past 3 weeks now, our number of COVID cases is very low. And this is what's happening in the rest of the world. So in the world, the number of COVID cases is down. We're still not exactly sure what's happening in China, but they presumably had a big surge in cases in December and early January when they relaxed their restrictions. There were reports of lots of hospitalization overflow and lots of deaths, but much of that has gotten better. And so the thought is that they had a huge wave of COVID, but not a lot of deaths, and they're pretty much over it. The rest of the world is pretty much over it. There's still a fair number of cases in the Pacific Rim, a little bit of cases in Europe, but the rest of the world is really quite quiet. In the U.S., we're quite quiet. We have sort of a steady number of cases over the last 3 weeks. There's no real hotspots in the U.S., a little bit more in the Southeast than in the rest of the country. But for the most part, things are quiet in the U.S. In Oregon, our number of cases is down. Our number of hospitalizations are down. And in Douglas County, we're seeing the same thing. So in Douglas County, we're seeing just a few cases a day, just a few people in the hospital. We are still seeing some deaths. And overwhelmingly, those deaths are in people who are not up to date on their vaccines. So it does still seem important to be up to date on your vaccines. We've heard from the federal government that they're going to declare that the pandemic emergency is over in May. That doesn't mean that the disease has gone away, but it means that the disease is at a level where it's not causing major disruptions to life. So I really think in Oregon, it caused really major disruptions really until about the Christmas of this year. So before that, there was hospital overcrowding. There were big outbreaks in nursing homes and other places. But really, since the beginning of this year, it's really been quite quiet. And we are really going to be looking forward to the end of this pandemic. COVID is likely to continue, so it's unlikely to be 100% eradicated because it is quite so contagious, and it will seek out those people who are unimmunized and infect them. But as those people get less and less and less, the disease will get less and less and less. My prediction is that it'll continue at a low level for the next several years. We might still see some new variants, but if it only spreads in low numbers, you're much less likely to see variants than when it's spreading in these enormous numbers like we had in 21 and 22. So again, good news. The other things we've been worrying about over the last 6 weeks have been influenza and RSV, or respiratory syncytial virus. Influenza also really quite quiet at this time. We had a big surge and really an early surge in November and December, but that's been quite quiet now. We get numbers from the hospital every day about how many flu cases. I think we've gone now 2 days in the hospital where they've not seen a single case of influenza. RSV continues, but they have quite a peak in December. We're still seeing a couple of cases, but that really is so much more quiet than before. What we are seeing, though, is other viruses circulating. So adenovirus, parainfluenza virus, metapneumovirus. These are other viruses that are out there that cause nasty colds. So anybody who's been around town knows that there are people out with colds and such like that. But they're usually from one of these other viruses that rarely cause severe disease and rarely cause hospitalizations or deaths. So although we look at them, we're not really too worried about them because they don't cause the huge disruption as does flu and COVID. So again, good news. I'm hoping that things are going to be so good that at some point we can declare this pandemic over and focus on the many other public health issues that we deal with. So Vanessa is our modernization person. She's working on bringing public health into the next generation. So welcome, Vanessa.
Thank you. Good morning.
So I heard you had some questions.
I do. So yes. So we thought as we as staff met this morning, we started talking about the emergency declaration and how we are approaching the end of COVID. So I thought this would be a good time to have a Barbara Walters style interview with Dr. Bob. So my first question for Dr. Bob about the pandemic, and as we're approaching the end of this, not the end, but the end of the pandemic, tell us, what is one of the most, not the most, but one of the most memorable things that you have in your mind about the pandemic?
Well, one of the things that sticks in my mind is early on in the pandemic, uh, we really didn't know that much about what was going on, and it was really hard to know who had the disease and who did not. So it was really important that we got some testing. There was no testing available in Douglas County. So over the space of really just a few days, we put together a plan where people would drive through at the fairgrounds. We would go ahead and swab their noses, bring the swabs, and they would get sent to a place in California, and had some of the first mass testing. This was a little dangerous when we did it at the time. We knew that this was contagious and really quite serious. And so we set up a pretty amazing situation where everybody was very carefully protected using these moon suits that we did. Great teamwork in getting people in and out. And we were able to do that. So standing in the cold breezeway there at the fairgrounds, dressed in a moon suit, sticking things up people's noses, was really quite a memorable start to this pandemic.
Absolutely. It's the image is burned in my mind forever, I'm sure. Second question is a little harder. And what are some of the toughest parts of the pandemic from your experience?
Well, the toughest part for me was the disagreement about people about things that there really should not have been much disagreement. So when we started off in this pandemic, I think one of the great things was the Warp Speed Project, which helped us as a country, as a world, to develop vaccines in a very short period. It was actually brilliantly conceived, mostly I think by Alex Azar, to be a program where we would do all of the safety steps for the vaccines, but we would cut out the other delays that were not related to safety. And really, in an amazingly short time, we came up with amazingly effective vaccines. So when I was asked to predict the effectiveness of the vaccines back before we knew what they were, we said, well, there's a lot of risks here. We've never had a really, really effective vaccine against a respiratory pathogen. And this is a new technology which could work great or it may not work at all. And it turned out that it worked great. It really is a phenomenal vaccine. And so we as a country were kind of together in getting this vaccine. But then right around January of 2020, when the vaccine was out, we got so much misinformation and disinformation about the vaccines that it really, really stopped the effort. And the amount of hate and discontent about COVID has been really monumental. We've been through other things in this country, influenza epidemic back in the 1920s, polio epidemic in the 50s, and we didn't see this amount of rancor and hate and discontent that we've seen with COVID. And for me, that's been the most troubling part about this pandemic, because we as a country will face other great struggles. And if we are as divided and as unhappy with each other as we were during the pandemic, we're really going to struggle.
Absolutely. Good point. Really good point. So the last question is, if you could go back and talk to Dr. Bob in March of 2020, now, knowing what you know now, what would you ask? What would you tell him?
Well, that's a tough one because I have not yet mastered time travel. Actually, I was thinking about this one day and thought, is there something more or different we could do? And there's little things we could do, but I think not much. I've pulled back a bunch of the things that I've done in March of 2020, and really there's not much to take back. I think one of the best things was this pandemic has brought in a number of incredible people to public health. So I remember hiring you in the space of about one day. We knew, I think it was in March of 2020, when we knew that this pandemic was going to be terrible. And the point was, let's marshal forces. Let's get the very best people we can to do this. And we hired you and dozens of others at DPHN to get through this. And I think we did a good job to do this. I think what I would tell Bob Dannenhoffer of March 2020 is this is going to be a marathon. This is not a sprint. At the time, we didn't know that this is going to be a marathon, and this is not going to be a sprint. And work not only on building the program, but we'll work on building great relationships with other people at DPHN and other people in the community. And I think we did a pretty good job with that.
I concur, absolutely. Well, it's been a I won't say great ride because it is a pandemic, but it's been quite the experience, and I'm sure we'll be talking and thinking about it for many years to come.
Great. Well, thank you so much, Barbara. You were wonderful.
Thank you, Dr. Bob.